What is up, my lovely guys and gals and gender non-conforming pals? Welcome to my channel. For those of you who don't know me, my name is Spencer. I'm from Vancouver, Canada, and I'm 25 years old. Today I just wanted to make this video to talk about my bottom surgery, otherwise known as GRS for gender reassignment surgery or SRS for sexual reassignment surgery. So I wanted to go over a couple of things today, just kind of starting with kind of my overall experience, the type of procedure that I had, the time I spent in the care facility afterwards, and then 1 month and then 2 month kind of post-op. Yeah, so let's get right to it. So 2 months ago, I flew to GRS Montreal, which is the primary place that most trans women will go to in Canada for the surgery. Thankfully, they do receive funding from the Canadian government, so I didn't have to pay out of pocket or anything like that, which was really, really great. And I had my surgery with Dr. Brassard, who's very, very qualified and has been doing the surgery for a lot of years and is definitely at the top of his field. So I had vaginoplasty with cavity using the penile inversion technique, for those of you that are wondering about the specifics. So that way I would have full sexual function and use. Yeah, so I wanted to start off with just kind of my experience at GRS Montreal and Asclepiade and just kind of how everything went. So when you get there, it's very, very bright and modern. It's located in a really nice neighborhood, like kind of right near the water in between Montreal and Laval, if you're familiar with the area or not. And the staff were amazing the whole time. They were super, super sweet. Even though I speak French immersion as a second language, they were happy to speak with me in English and to make sure that if I had any questions that they were answered. And so when I got there at about 5 o'clock in the morning, and before showing up I had to do a couple of pre-operative things. So first of all, I had to do a shower in the evening with this special antibacterial chlorhexidine soap, which is kind of like orange, but I didn't burn or anything, which was great. I was a little bit worried because I have more sensitive skin, but it didn't really burn or anything, which was great. And then the morning of, I had to use, oh, hi, Teddy. Are you coming to visit and say hi to everyone? Hi, baby. The morning of, then I had to use a depilation cream, a hair removal cream, in order to remove all hair in the area from kind of the pubic mound all the way back through the butt crack. And then after that, I had to do another shower with the antibacterial soap just to help prevent any kind of infection and minimize the chance of anything going wrong post-surgery down there. And then upon arriving to the facility, after signing a couple of consent forms, I got taken to my room, which I would be staying in GRS Montreal. And from there, everything happened pretty quickly. I was the first patient of the morning. So I didn't really have to wait for very long. I kind of got brought in. I got changed out of my clothes. I put my scrubs and my little feet cap things on, and my robe, and I waited for Dr. Brassard to come and give me kind of the pre-surgical kind of check over. It was very cold in there, and I had a little bit of anxiety, but it wasn't as bad as I was expecting it to be beforehand. So because of COVID, I was only able to have one visitor come visit me at a time, and I was lucky enough to have my girlfriend Kelly and my mom come with me for kind of emotional support, but because of the restrictions, only one of them could come with me and see me off into surgery. So when I was in my room waiting for Dr. Brassard to come in, I was with my girlfriend, and she was the only one that could come with me because my mom wasn't allowed into the building at the time. But it was very nice. Dr. Brassard came in. He did a kind of quick check over just to kind of inspect the area and make sure that I had enough tissue to work with and that everything would go fine. And from there, they brought me up to the surgery, kind of the surgery floor. It was a floor above where my room was. And I had to kind of sit and wait while they prepared the operating room. I was probably there for like, I don't know, 15 or 20 minutes. It was a little bit kind of nerve-wracking to just sit there and wait, but all the staff were so nice and so reassuring that I'd say my anxiety was pretty low, like maybe a 2 or a 3. So overall, like definitely not complaining. Now, when I got brought into the operating room, they had me lie down on a kind of like T-shaped bed where there was 2 spots for my arms and then my like main spot for my body to lie, of course. And they started kind of hooking me up to monitors and to IV and to all those kinds of things. And then it was time for them to give me the spinal anesthetic. Now, this was probably the worst part of the entire experience. They basically have you kind of like curl over to stick your spine out and hold on to a pillow, and they take a needle and they shove it into your back, and that's basically just to numb you from the waist down, so you won't be able to move your legs during surgery, and to also help reduce like post-surgical pain, because for like the first 24 hours or something afterwards you won't really be able to move your legs. So my legs were just gone, they didn't exist. But the needle was really, really unpleasant, and it seemed like it took forever. Like I just kept putting more and more and more anesthetic into me, and that was probably like the part that hurt the most. And then they gave me kind of like a light type of sedative, I guess, that just kind of put me out. So I wasn't under general anesthetic, but I did fall asleep like pretty quickly afterwards. And then upon waking up in the intensive kind of post-surgical room, basically they constantly monitor you for about 30 minutes after surgery in this kind of around full-time staffed unit. And I did have one complication where I was like shivering uncontrollably, and it was pretty unpleasant. So my whole body would like constantly shake and my teeth were shattering and I couldn't stop it. So they gave me like 2 or 3 doses of a certain medication to make that stop. And then after that, that was about it. I got rolled back to my room and I was able to see Kelly within like half an hour after being rolled out of surgery, and the worst of it was over at that point. After I woke up from surgery, the recovery process began. You spend a total of 8 nights at the facility in between GRS and Asclepiade in Montreal before getting sent home. Hi, baby Snoop. So right after waking up, I wasn't really in any pain at all. They had me like on some really, really good drugs, so I couldn't feel my legs down from the spinal anesthetic. And when they did have me on like some form of opioid as well, I don't really remember, as well as antibiotics and like an anti-nerve medication that would like prevent the nerves kind of attaching and stuff from hurting too much. On the first 2 nights, you're staying at GRS, which is like the more kind of surgical hospital-based unit of the duo. It's basically nurses will kind of do most of the things for you. You still have the catheter in. You aren't needing to catheter in and the pee bag attached, so you aren't needing to get up to go to the washroom or anything. So basically the first day, you're pretty much just lying in bed. They do have you get up 1 time because it helps with blood circulation and overall the healing process. Just by getting up really supports the healing process. So they make you get up first day, which I was pretty worried about. I was worried it would be horrible, but I was able to get up the first day without really any difficulty at all. Granted, like I wasn't able to like sit directly flat. I had to like kind of roll over my hip to not put pressure on the area, but it was totally doable. And then starting the second day, they actually had me get up and walk around and do laps around the facility in the morning after breakfast, the afternoon after lunch, and the evening after dinner, so 3 times. And then after your second night in the morning, when you wake up, they transfer you to Asclepiade, which is basically the care home. It's kind of like a big house located on the same property that they'd converted into a group home. And so basically just everyone in the group home are people who are recovering from having surgery at GRS Montreal. Now, because of COVID, the rules were a little bit different than it usually was. My understanding is that without COVID, there's supposed to be Not really any visitors in the room. You're supposed to spend more time out in the communal spaces and with like other patients and stuff. But because of COVID, of course, you had to be masked at all times, and basically remain in your room unless you were either going to the washroom or just going for a walk in order to kind of, again, help that healing process and continue that blood flow. So it was fine. I just kind of stayed in my room for the majority of the time by myself. But Asclepiade really expects you to take more of an active role. Hi, baby. Hi. Teddy cam. Ooh. They would expect you to take more of an active role in your recovery. So they expect you to change your own dressings. They take the catheter bag off. So at that point, you have to actually get up and go to the washroom on your own. They pretty much expect you to ask for what you need, and to be a lot more on top of taking care of yourself, which I didn't really mind. None of it was really too difficult. Nothing they were asking you to do is like ridiculous or completely undoable. And so, oh, hi, baby. I'm kind of in the middle of something here, sir. Do you mind? Do you mind? Now, at this point in your recovery, when you're back at Asclepiade, there are still a number of things you have to kind of overcome and go through before getting discharged. So, first of all, you still have like your packing inside you, which is basically like a big condom filled with gauze just to like keep the vaginal canal open and stop it from closing up. You also have like this external piece of dressing that's basically sewn onto you, in order to kind of stop you from like basically bleeding out. You have a blood drain attached to the top of the vagina, kind of around the pubic mound, which is just bleeding excess blood, and also a way for them to monitor the amount you're bleeding to make sure that you're not like bleeding out or there's too much blood loss. And then there's also the catheter that still needs to be brought out. So there's a number of things that they still need to do, and most of those things don't really happen until the end of your stay. So I don't think I got the dressing removed, if I remember correctly, until I want to say the 4th or 5th day after surgery. Something along those lines. And then even after they take the dressing off, you still have the catheter inside as well as the packing to keep the vaginal canal open. And they only remove the vaginal packing on, for me, it was the Saturday, and I had surgery on the Monday, so it would have been the 6th day, because then once they remove the packing as well as the catheter, that's when you start dilation. So that's why it stays in for so long. Now, all of it I was expecting to be way, way worse. Like the removing of the stitches, they basically have the gauze sewn onto you, so they have to kind of take little scissors and go and cut each incision away and then pull out the stitching. I was expecting it to be way more painful. Honestly, it felt like each time they cut it, it was just like a release in pressure. It didn't really feel too horrible. And then I was really expecting the removal of the catheter to just be like absolutely god awful, but it was pretty quick and painless. Even like pretty freshly after surgery, it wasn't that bad, and I was really mostly just on Tylenol with the occasional tramadol for the pain, which is like a very, very mild opioid. It's not like a have fun, feel like whacked out on it opioid. It's like very, very mild. So even though I wasn't on that much pain medication, the pain was still very, very manageable. And then following that is when they teach you how to do your dilations. They kind of show you the ropes one time, what to do, how to use them. And then they kind of give you like a little quiz at the end to make sure that you were like paying attention and listening and do everything right. And they also show you how to go through the after dilation process as well, which is showering, douching, and sitz bathing. All of the times for the first time you do it, the nurses are kind of there to instruct you and guide you through it to make sure that when they send you home, you're feeling comfortable and set up and know how to do everything. Now, I know what you're all wondering. What about the food? Was it trash or was it gas? I take photos of my entire time there. I was a very successful hospital food blogger for my time, and I'm happy to tell you how the food was. So there were a couple of things that were absolutely amazing and like 10 out of 10. All the things that were 10 out of 10 were when the kitchen staff weren't trying to do... Baby, I'm trying to record! Were when all of the kitchen staff weren't trying to do too much. So the best things, and I'll include screenshots of, were the chicken quesadilla. Oh my god, the chicken quesadilla was so good. That shit hit the spot. It was fucking amazing. They did this sandwich. It was like a grilled cheese with like some kind of ham or something inside of it. That was fucking amazing. And then the macaroni and cheese was really, really good. And when they had a meal that was like really, really simple, just potato wedges, broccoli, and grilled chicken. Hi, baby. And that was like simple, but anything with potatoes like fuck me up, I'll eat it. So it was really, really good. I love that. Now there was a couple of things that were just kind of like lackluster. They were mediocre. They were fine. They were edible. They did a lot of like try to do just plain balanced meals where you'd get like fish and rice and a vegetable, or like ham and potatoes and a vegetable, stuff like that. It wasn't like the most flavorful, but it was okay. And then there was definitely a couple of flops. Boo, can you call him?
Baby Snoop!
There was definitely a couple of flops. So there's this one thing, I was like, I'll include a picture of like this weird like egg loaf thing where basically they just like cracked a bunch of eggs, threw it in a pan, baked it in the oven. It was like this weird cutout cube of egg. It was kind of bad. There was like this weird rice quinoa like beet ball, and it was like this weird purple little ball that wasn't great. Like whenever the staff tried a little bit too hard on what they were making, it didn't turn out well. But overall the food was good. I'd give it like overall say like a 6, with a couple of meals being really good, like a 10. And then you get to pick your own breakfast. So every morning I had the same thing. I had hard-boiled eggs and oatmeal with orange juice. And I had the exact same thing every day for breakfast. It's kind of like they give you a sheet you get to pick from with breakfast items, and then you just kind of go about your biz and order and eat whatever you want. And this was honestly a really big for me, eating. It was a really big topic and something I was really worried about. Because for those of you who know or don't know, I have a lot of really severe allergies. So like life-threatening anaphylaxis to all beans, all nuts, so like soy, sesame, just a bunch of stuff. And so I was really worried about eating the hospital food, but thankfully they didn't kill me, and it definitely helped me kind of grow and trust other people feeding me more as well, which was definitely a win. But yeah, overall the food was like definitely okay. It's, I'd say, better than I was expecting for hospital food. So from there, after the 8 days in the care home, basically I needed to fly back home to Vancouver, which wasn't the most pleasant. It was like a 5-hour flight, but they give you like a funny, cute little butt donut, inflatable butt donut to sit on, which helped, but the flight home wasn't fun at all. It was like a 5-hour flight. There was turbulence. Felt like I was gonna throw up. It was just overall not pleasant. But then upon finally making it back home, I was so happy to be back in my own bed. Like, as nice as the staff were, and as nice as it was to have everyone there to ask questions and support, I was so missing sleeping in my own bed and just being comfortable and not constantly feeling like I was in some medical facility, and I could get a little bit of privacy and peace of mind. And it was really nice because my partner was able to take the first week off after we got home with me to kind of like make sure that any help I needed, she was there for, and she was able to help me with anything and kind of like do cleaning and cooking and stuff, because at that point I wasn't very mobile. But yeah, so next what I want to talk about is kind of that first month after surgery, how it went, and kind of what the process in that first month was like.